Hi guys, welcome to my channel. This is Dr. Feben speaking. I'm a consultant ophthalmologist, and today I'll be talking to you about cataract. So as we all know, cataract is a clouding of the normal crystalline lens, and it is a leading cause of preventable blindness worldwide. The prevalence of cataract has been increasing yearly, and it is expected to reach 50 million by the end of 2050. So the causes of cataract can be either it occurs by birth or it occurs through as the age progresses. So if it is coming by birth, most commonly the causes would be due to some intrauterine infections or due to any maternal drug intake or radiations or due to any birth trauma. But if it is occurring during the course of the age, it could be an age-related one, which is the commonest cause of cataract worldwide, or it could be due to other risk factors like smoking, alcohol, drug intake, due to any injuries, again radiation exposure, and due to other diseases like diabetes mellitus. So what are the most common symptoms which the patients will complain of? They are fogginess in the vision, decreased night vision, and increased light sensitivity, especially when they're driving at night. They may even complain of halos or even glares, double vision. They may complain of yellowing of the sight, reading difficulty, or even some patients may complain about loss of distance vision, but improvement in the near vision, which we call second sight. So the main thing is, how do we prevent this cataract? Prevention of cataract, although which is coming due to age, which is not fully preventable, but to some extent can be prevented by good intake of antioxidant and healthy foods which contain vitamins, vitamin A, C, E, fruits and vegetables, and the use of sunglasses to protect our eyes from ultraviolet light. Regular eye checkup, at least once in a year. Everyone is supposed to get a regular eye checkup done to totally avoid intake of alcohol and smoking, and those with high blood sugars or with a family history of diabetes to get their sugar levels checked at least once in a month. Now the treatment modalities, they include medical treatment. Mostly those who are having complaints, we will first give them glasses and see if there is any improvement in the sight. If patients are comfortable with glasses, we just ask them to continue the glasses and follow up once in 6 months to see how they are faring. But if patients are complaining, giving complaints even after using glasses, then the last resort would be to go for a surgery. So surgery for cataract mainly involves there are different types of cataract surgeries, but the commonest one which is performed nowadays is the phacoemulsification, which is using ultrasound technique, where through a small incision, like around 2.2 to 2.8 millimeter incision, and we go into the eye, remove the cataract, and we implant a intraocular lens. The older techniques are like small incision cataract surgery, extracapsular cataract extraction, and intracapsular cataract extraction. The last two, which is extracapsular and intracapsular, are almost obsolete now, which we don't do nowadays. Usually in the olden days, cataract surgery was done just to remove the cataract and to give to remove the fogginess of the vision and to give a good vision to the patients. But now cataract surgery is mainly focusing on not only removal of the cataract, but also to give them a good refractive correction, so that patients need not use glasses most of the time to do their routine day-to-day activities. Now regarding phacoemulsification and the lenses used, I'll be talking to you in the next video. If you like this video, just comment and let me know. Thank you.